The session is on local drug delivery and it will be covered under the following headings: introduction, scientific rationale, objective, delivery systems, indications, contraindications, classification of local drug delivery, and periodontics. Introduction: treatment of periodontitis is routinely based on oral hygiene, root debridement, and risk factor modification. Given the bacterial etiology and the inflammatory pathogenesis of periodontitis, the adjunctive use of locally applied or systemic administration of antimicrobials and/or post-response modulating medications has been proposed. So, scaling and root debridement alone is insufficient to eliminate the bacteria from the periodontal pocket, especially in inaccessible areas. Antibiotics, both systemic and local, have been used as adjunctive agents in the management of periodontal disease. The scientific rationale include the site-specific pattern of destruction of periodontal infections, potential side effects of the systemic antimicrobials and anti-inflammatory agents, marginally effective local concentrations of free active drug in the periodontal pocket when given systemically, and when locally delivered, it kills and inhibits the subgingival bacteria that are not accessible or eliminated by hand or power-driven instruments. The objective: the use of a local antimicrobial is to prevent or control microbial-induced inflammation in an effective concentration and be maintained there long enough for the desired effect to be accomplished without causing any side effects. The primary goal is the achievement and the maintenance of therapeutic levels of the drug for the required period of time. Delivery systems are basically classified into two. One is the controlled delivery system and the other is the sustained release. Controlled delivery system is where the drug is released at a predetermined rate for a specific period of time, and it is also referred to as timed release or controlled release. Sustained release is where a portion of the drug is released immediately to achieve a desired therapeutic concentration and the remaining is then released slowly. It's also known as prolonged release, slow release, sustained action, prolonged action, or extended action. So the drug delivery devices are majorly the fibers, films, injectable system, gels, injectable gels, strips and compacts, and vesicular, microparticular, and nanoparticle systems. Fibers, they are thread-like devices, reservoir-type systems, placed circumferentially into the pockets with an applicator and secured with cyanoacrylate adhesive for the sustained release. Examples including chlorhexidine fibers and tetracycline fibers. Films, the drugs are distributed throughout the polymer. They are cut into small pieces suitable for insertion into the periodontal pocket, and the drug is released slowly with degradation of the carrier matrix. They are easily inserted into the pocket with no additional aids for retention. Examples including chlorhexidine, metronidazole, tetracycline, and minocycline. Injectable systems, the application can be easily and rapidly carried out without any pain by using a syringe, and the cost is considerably reduced. The injectable delivery system should be able to fill the pocket, reaching a large proportion of pathogens. Gels are basically mucoadhesive in nature. There's a high safety profile, longer retention, and antimicrobial activity. It has to be applied subgingivally with the help of a blunt cannula and syringe. Examples include the doxycycline and metronidazole. Next is strips and compacts. These are thin, elongated matrix band comprising of an elastic polymer with drug dispersed. The strips containing tetracycline, metronidazole, or chlorhexidine demonstrated a decrease in number of motile rods, notably spirochetes, and their effect persisted even after 3 weeks of removal of the acrylic strips. The indications of local drug delivery includes isolated periodontal pockets of greater than 5 mm with successful pre-spawn therapy. Periodontal patients who are medically compromised where surgical therapy is contraindicated, in patients who are suffering from recurrent or refractory periodontitis, and during periodontal regenerative procedure. Contraindications include multiple sites with probing depth greater than 5 mm that exist in the same quadrant, the use of the agents has failed to control periodontitis, the presence of intrabony defects, and in periodontal patients with known hypersensitivity reaction to any of the antimicrobials used for the periodontal therapy, in pregnant or lactating patients, then patients susceptible to infective endocarditis to avoid the risk of bacteremia. So the various agents or drugs that are used in local drug delivery include tetracycline, doxycycline, minocycline, metronidazole, chlorhexidine, and other drugs like clarithromycin, alendronate, ofloxacin, and clindamycin. So coming to tetracycline, the tetracycline LDD systems are the active site, periodontal AB plus, and periocole TC. Tetracycline fibers, that is the active site. The first delivery devices involved the hollow fibers of cellulose acetate filled with tetracycline. They are non-resorbable, and there is 2.7 milligram tetracycline hydrochloride in 9-inch film. The fibers packed into the pocket and secured with a thin layer of cyanoacrylate adhesive and is left in place for 7 to 12 days. The next is periodontal AB plus. These are bioresorbable, which will take around 7 days, and tetracycline fibers with a base of collagen film. There's 25 milligram of pure fibrillar collagen with 2 milligrams of tetracycline hydrochloride. It should be retained with a periodontal dressing or dental adhesive for 10 days. Then is the periocole TC. There's fish type 1 collagen of 25 milligrams, in which 2 milligrams of tetracycline hydrochloride is present. It is biodegradable and releases tetracycline in vitro for 8 to 10 days. There is a need for periodontal dressing, and it is usually sterilized by gamma radiation, and the shelf life is around 2 years. The fibers are moistened with saline and placed into the periodontal pocket, depth of the pocket base. So the next is minocycline, which is a semi-synthetic tetracycline and is of the broad spectrum nature. The local delivery can be done as films, microspheres, and ointments. It's basically bacteriostatic in nature by inhibiting the protein synthesis. So as a local drug delivery device, it can be used as microspheres, that is Aristin, ointment such as periofil and gentamicin. So minocycline microsphere, that is Aristin, it is an FDA approved drug and is biodegradable in nature. It's a subgingival controlled release delivery system, and there is minocycline HCl in bioresorbable polyglycolide co-DL lactate polymer in unit dose cartridges. That is 1 milligram of minocycline free basis present. Next is the minocycline ointment, which is the periofil. It is also bioresorbable in nature, and it is a sustained local drug delivery system. The periofil contains 10 milligrams of minocycline in 0.5 grams of ointment in a disposable polypropylene applicator. The next is gentamicin or perioclin, and minocycline hydrochloride dihydrate equivalent to minocycline 2% by weight is present, and it is also biodegradable in nature. The next drug is doxycycline, which is a broad spectrum semi-synthetic tetracycline and is bacterial. The Atridox, which is a subgingival controlled release product, which has a 2-syringe mixing system. Syringe A contains 450 milligrams of Atrigel delivery system, which is a bioabsorbable, flowable polymeric formulation composing of 36.7% poly-DL lactide dissolved in 63.3% N-methyl 2-pyrrolidone, and the syringe B, which contains 50 milligrams of doxycycline hyclate, which is equivalent to 42.5 milligrams of doxycycline. The constituted product is a pale yellow to yellow viscous liquid with a concentration of 10% of doxycycline hyclate. Now chlorhexidine. Chlorhexidine gluconate is an antimicrobial agent which is active against a wide spectrum of gram-positive and gram-negative organisms, yeast, fungi, facultative anaerobes, and aerobes. The first is periochip. It's a unique patented targeted controlled release biodegradable polymer containing chlorhexidine. It is small, bullet shaped, or a baby's fingernail shaped like thin film weighing 7.4 milligrams. It measures 5 into 4 millimeter in size and 0.35 millimeter in thickness. The chip contains 2.5 milligram chlorhexidine gluconate incorporated in a biodegradable matrix of cross-linked hydrolyzed gelatin. The next is periocole CG chip. It is prepared by incorporating 2.5 milligrams chlorhexidine gluconate in collagen membrane, and the size is 4 into 5 millimeters and thickness is 0.25 to 0.32 millimeters. It weighs around 10 milligrams and resorbs after 30 days. However, the coronal edge degrades within 10 days. It requires a dental dressing. Next is chloride. There's 1.5% chlorhexidine of xanthan type, and the gel contains two types of chlorhexidine, a slow release chlorhexidine digluconate 0.5% and a rapid release chlorhexidine dihydrochloride of 1%. The next is metronidazole, which has a selective efficacy against obligate anaerobes. In the recent past, metronidazole has been incorporated as collagen sponges, dialysis tubing, acrylic strips, films, and gel forms for sustained subgingival delivery in the treatment of periodontal disease. Metrogyne, it is a new combination of two known substances, bovine collagen type 1, sponges into which metronidazole is incorporated at a concentration of 5% in the finished product. Elizol, metronidazole benzoate 25% in a mixture of glyceryl, monooleate and sesame oil is present, and the gel disintegrates in the pocket and releases metronidazole. So to conclude, local drug delivery often appears to be as effective as scaling and root debridement with regards to reducing the signs of periodontal inflammatory disease. Local drug delivery systems usually do not provide a benefit beyond what is achievable with conventional scaling and root debridement in the treatment of adult periodontitis and in isolated pockets also. Present, there is insufficient data to indicate that one local drug delivery device is clearly superior to all the other systems. However, desired characteristics include the ease of placement, controlled release of drugs, and resorbability. Thank you.